Thank you, Rob. That was my my ping. So welcome. In partnership with the German WASH Network, I welcome you to this series of virtual events for the humanitarian WASH sector. The idea of this series is to have an in-depth look at topics and trends with experts and time for exchange. WASH United, the organization I'm working for, is the lead on menstrual health and hygiene, menstrual hygiene management, MHH, MHM, like we'll use this abbreviation throughout, for this series. And this series, the WASH series and the MHM series, will continue in 2024 and 2025. So today is just the kickoff. My name is Ina Yoga, and I'm the international coordinator for the International Menstrual Hygiene Day and technical lead on menstrual health and hygiene here within the organization. My colleague with me is Aya Senbel. You'll find her as well among the participants. She's the Junior Partnership Manager for Menstrual Hygiene Day and MHM Education. And she's managing the chat box, so you'll hear her chatting. So, bienvenue, je vous souhaite la bienvenue à cette série d'événements virtuels pour le secteur EAH humanitaire. L'idée de cette série est d'avoir un regard approfondi sur le sujet et les tendances avec la contribution d'experts et du temps pour l'échange. WASH United est responsable pour le sujet de GMH pour cette série qui se poursuivra l'année prochaine et en 2025. Je m'appelle Ina Yoga et je suis la coordinatrice internationale de la journée mondiale de l'hygiène menstruelle et aussi responsable technique de la GMH. Ma collègue Aya Sembel est avec moi et elle m'accompagne et gère la boîte de dialogue, le chatbox. So in 2023, we now want to start the series with the topic that is very dear to our heart, but we also see as a foundation. It's education and breaking taboos in the society, in the communities you're working around menstruation. Pour cette année, nous voulons commencer par un thème fondamental de la GMH, c'est l'éducation et briser le silence, briser le tabou et la sensibilisation, surtout la menstruation. First, I want to do some housekeeping. So, tout d'abord, je voudrais commencer par des informations générales. So, please mute yourself. I think this is automatic. And then you can have your video on and off like you want. And we have a Q&A, then it would be nice if your video is on. And the chat box is your friend this morning. So present yourself in the chat box. Présentez-vous dans le chat box. But also use the chat box for all your questions and comments. So we'll have enough dialogue and exchange. So questions to the presenters, and then also in the discussion later, we will check the chat box for questions and then draw from there. So anything, please start using the chat box. And then later we abort the chat box during the discussions, but it's good to have a lively chat box as well. So we don't have a simultaneous translation for the reason that it always is a problem, a technical problem. Like I've seen that so many times. So instead we thought we'd bring a translator, and bienvenue and welcome to Céline, who's here. Cécile, sorry, Céline. And she will help for the translation of one presenter from French to English, very classical one-on-one translation. But everything that you say, she will also and put in the chat box, she will help us for the question and answers. Nous n'aurons pas de traduction simultanée parce que cela crée souvent trop de difficultés techniques. Mais nous avons une traductrice avec nous. Bienvenue à Cécile. Elle est là pour traduire en anglais la présentation française de Jolie. Et aussi, elle est là pour traduire vos questions en français à tous les présentateurs et traduire la réponse. So, elle est là pour ça. Et Aya va résumer les points clés de toutes les présentations en anglais dans le chatbox en français. So, tu ne manques quelque chose. Et aussi, s'il y a des gens qui parlent français, qui préfèrent parler français, dans la partie 2, nous avons des discussions, on faire des groupes en anglais, en français, si c'est préférable. Alors, maintenant, continuerons maintenant en anglais. We'll continue now in English. I want to start with a few setting the scene slides so we know what we're talking about. And I want to start with to say that 1 in 4 people in emergencies are women and girls in reproductive age, around the age of 15 to 49 years old. And they will have their menstruation throughout the emergency, throughout the humanitarian setting, unless they're pregnant or breastfeeding or have a health concern. But you really, this is an issue that on day 1 of the emergency, you will have women who have their menstruation and who need to manage their menstruation. So this is a big group of people that we're talking about. Another big group are children who are displaced. And this is 43.3 million. So unfortunately, it's a record number. And 48% of them remain out of school. Today we talk about education, about menstruation, and a lot of things are happening in schools. So therefore, it's very important to have this number in mind. Unfortunately, there's these children out of school, and in times of crisis, school is so important because it protects children's development and supports their psychological and well-being. And it also offers them a sense of hope and connection in times of this crisis. And thus, it's a really high priority in humanitarian settings. Among these numbers, we see that girls are more likely to be out of schools. In conflict-affected countries, this is 2.5 times higher. Sometimes in emergency settings, according to UNHCR, the number is less. The difference is less high, but it is definitely the fact that girls are less likely to be in schools. And unfortunately, menstruation and poor menstrual health and hygiene is a reason why girls do not attend school when they're on their period. They drop out or they just don't attend during the days they have their period. What is the impact of that? It's not only like poor health and well-being, but out-of-school children and young people are at greater risks of violence, rape, recruitment, life-threatening consequences, but as well also for continued poverty and lesser economic development for themselves, for their future families, and for the society. So importantly, providing education in emergencies sustains the children who at least go to school or we come back to schools, and reducing the impact of this crisis and securing this. And we talked about that periods happen for young girls at the age of puberty and menarche. But every person, not only girls, but also women, should be able to manage their periods safely, hygienically, privately, and with dignity, as well during emergencies. And we know that during emergencies, the challenges are even exacerbated. And we know period poverty exists in the normal developing context, even in Germany, but in humanitarian settings, it's even higher. To achieve good menstrual health and hygiene, good MHM, several components are at play. They all are interlinked. That is MHM supportive facilities, MHM materials and supplies, and MHM information, which also includes education, but also breaking the silence. MHM is really cross-cutting, and you also see this today with our presenters, that it touches across protection, education, health and sexual reproductive health, and WASH, even shelters and supplies. So when we talk about education and awareness and emergencies, there are hardly any numbers. So unfortunately, I can't share numbers, but I always like to share quotes, which is like really the qualitative evidence about the challenges and the lack of education, the level of taboos in societies. And I pulled out two quotes. One is from Lebanon and one is from Cox's Bazar. And actually, they're very similar when you look at this. Girls and women feel ashamed about their periods. There's a range of taboos and restrictions that they face, and they don't really feel comfortable talking about it to their mothers, their sisters, or in their families, let alone their teachers. So, and why is education? I mean, we all agree that education is so important because it provides people, and I talk here of people because not only girls, with life-saving information, including their protection, building their confidence, giving them information about life-saving practices such as hand washing and other survival skills. And when we talk about education about menstruation, it means that girls and women learn about how to maintain good health and hygiene practices. But it's also building critical knowledge and build confidence and empower them to make decisions to tackle negative taboos, gender norms, and also when to seek medical support. Today, I think a lot we'll talk about education emergencies is a critical component for school-going girls, but we heard there's a lot of girls who are out of schools. And also, MHM education is relevant for all ages. For young women, it might be around puberties, but we have also women throughout their years until menopause, where they need to have linked information. That could be then linked to pregnancies or family planning, but also other needs. And when talking about needs, we should always consider the needs of people with disabilities. The key reason why education and awareness about menstruation is so low is, what I already said, is stigma and taboos. Therefore, it's really essential to tackle these taboos and help women and girls to understand and address them. And furthermore, not only women and girls, but to engage teachers, the communities, families, boys and men in normalizing menstruation, because that's what they are, just a normal fact of life. So I don't want to preempt too much because we have excellent experts today with us. We have, let me introduce them in brief, and also with that, the agenda. We start today with expert presentations from these 4 or 5 speakers. And after each presentation, which is roughly 10 to 15 minutes, we have a question and answer with you, so you can ask your questions to the speakers. And then, so as I said, Jolie's presentation will be translated, so it might take a little bit longer. But we also have the translation for your questions, so please go ahead. Unfortunately, we don't have our friends from UNFPA Bangladesh with us, as was announced in the reminder. Because they're busy, and then there's also some processes involved with UNFPA, but they promised to be there for one of the upcoming WASH sessions because they have a wealth and a larger scale MHM program in Cox's Bazar. So they will be there in one of the upcoming sessions. Instead, I will I'm glad that we have found some excellent replacements from Sudan. That's Marwa Tageldin and Mihad. going to share their experience on bringing campaigning and education into Sudan. So welcome. So that's the first part. And then the second part is really experience sharing and learning from you, from the audience. What is your experience? What are your recommendations and solutions? Because we're very glad that this webinar will have a practical outcome. And that means we want to contribute with your learning and your insights to a 2-pager by the MHM and Emergencies Working Group that they're working on different aspects, including education. So this is not a webinar where you all learn, but it's also really contribute to some practical operational guidance. And then part 3, very much at the end, I want to know from you what could be the next topics for the upcoming MHM and Emergencies session, so you can have your say. Okay. Without further ado, I would like to introduce now our first speaker, who is Salam Ramdan, and she's the WASH field officer working for UNICEF Lebanon since 2000, so a long while already. Good morning. Before that, she was first aid and aviation health trainer for 7 years in Etihad Airways in the United Arab Emirates. And she's bringing, therefore, a lot of experience in health trainings, capacity building. She studied public health in the United States of America and has expertise in disease and emergency management. Good morning, Salam. And we're excited to hear about your experience and your program in Lebanon. Over to you.
Good morning, everyone. I'll start with sharing my screen, and then we'll take it from there. All right, can you confirm that you can see my screen?
Yes, we can.
Okay, so according to our experience in Lebanon, especially with working with the refugees and the host community, which includes a lot of stratas from considering it a shame of subject to considering it a normal subject to talk about. So that is, thank you for closing the microphone. So that we have to deal with all walks of life, which is also very intriguing for us. A little bit of overview on Lebanon, at least the context. So we have one of the highest number of refugees per capita. So yes, it's a very small country. Population almost 3 million. There's no actual consensus since a long time ago, but we just roughly calculate the numbers. And again, because there is a lot of illegal crossing between Syria and Lebanon, so as well the exact number of refugees is fluctuating a lot. In any case, since the break of the Syrian war 12 years ago, there was literally doubling of the population in Lebanon. And after that, imagine a country that is barely able to satisfy their own needs. Suddenly, all the needs have doubled, and in certain places, like in Beirut, where it's much more condensed, it has tripled. After that, the financial crisis. After that, the bombing of the port. We literally have economic meltdown in the country. More than 55% of the population is now in poverty, which is, again, it changed the whole scene for us. We used to only respond to the to the Syrian needs, but now we have to respond to the Lebanese needs and the Syrian needs, in addition to other nationalities. And we've been responding for the past 12 years. One of our responses is, of course, menstrual hygiene response, because we've noticed a huge increase in the hygiene poverty, and it was a term that we literally didn't deal with before, but now it's something that we have to deal with. So we do a lot of awareness campaigns and activities. We distribute a kit that we call Laha kit. Laha means for her in Arabic. It of course it has both reusable and disposable hygiene items, socks, small flashlight, etc., and the things that you know we deem as a sector, we deem it necessary to be in the Laha kit. One of our mandatory trainings is for any WASH practitioner that contributes to the Laha distribution or the campaigns for the menstrual hygiene awareness. They have to be GBV trained. Obviously, it's not a complete training for GBV case management, but at least they need to know how to refer, where to refer, and how to at least receive the first information from any victim or any person that approached them. Of course, we also train them on directing the health cases to the nearest PHC, to any locale that we are doing the event at it. Usually when we do the menstrual hygiene activities, we always have education partners, health partners, and GBV partners. In any case, for us, it's a complimentary day. We try to bring all the services in one day. Dealing with the refugee community, which is considered very conservative and religious, obviously they consider that the topic as shameful, taboo, etc. So during our focus group discussion, we found it's very important to tackle the religious corner, let's say, or angle to try to get them to be more engageful. We also found that the marital status of the ladies, of the females, it's very important, and to separate between girls and women, as we all know. And yes, that separation is doable based on the marital status, at least in the country, because girls' needs differ from women's needs. Girls' topic of interest is different than the others, and then as well the questions. And there's always the interest is a bit more different between between girls and women. So we created hygiene sessions that withdraw from Islam and to give them more confidence in talking about the subject and dealing with their bodies, etc. And we also designed hygiene sessions that included that this was purely made for males, delivered by males, and of course, and with the participation of physicians to make them feel more comfortable in talking about it. We usually provide the ladies with different options for reusable and non-reusable items, and we try to get their feedback on which one is for them is more comfortable to use. They're more comfortable in cleaning, etc. And we found the menstrual cups in the married women's cases to be the best option, because for them it's easier to clean, and it's very discreet, and they don't have to hang it out with the rest of the clothes to dry, because as well this is a shameful approach to them. In a lot of the cases, the women didn't appreciate using reusable pads because, again, it's the same issues. It's a lot harder to clean. It requires a lot of water, and it requires them to hang it to dry with the rest of the clothes, which they literally refuse to do. Men obviously were reluctant to participate in the awareness sessions, but upon seeing the physicians, they were more excited. And by the way, all the pictures shared in the presentation, it's from the field, from the pictures we took during our campaigns. We also found out that it's very important not to include any sex education in any of the topics that you talk about, because somehow it will be misunderstood and it will be taken out of context, and it might backfire on us, on our reputation. So it's always good to differentiate between the two topics and keep them separated. And as I said, it's always good to have the females, to give the females more options to use the menstrual products, because first of all, we don't want to limit their options just because they are in period poverty, and plus we want to encourage them to adapt the options that is more suitable for their bodies, because there is no one solution that fits all. The picture is one of the sessions to teach yoga to relieve the pain for the girls, and it was done in all school girls. Sorry, all girls school. So we targeted those schools. We have lots of those in Lebanon, and it was very beneficial, especially that the fact that there is no need to separate the females from the males and then contribute to the stigma. So the school was already divided. So that was a great target for education and WASH from both sides. Again, we reiterate on the importance of training the practitioner on GBV referral, at least in the minimum, so they be able to know how to handle in case somebody approached them for that. Allow a lot of questions to be answered, so give a lot of time for asking questions, because for them it's important, and there is no such a thing as one case is equal to the other. There is always a question that one lady would ask that is never asked before, and I've experienced that literally every session I've been through. Focus group discussion is very important because it will tell you your target audience. They will tell you then what they need. Because sometimes we design our awareness sessions without taking into consideration what they want to learn. But, sometimes, usually this is how we fail. We don't take into consideration our affected population and their opinion, which really counts. Don't discount the males. Yes, they are the other half of the society, and they're women, they're children, they're girls, they're kids, their moms, all of them, they are affected by the situation. So they need to understand at least the minimum basics so they can know how to support their females. And yes, sometimes we fight, let's say, the mold that the society put us in and the religion that's put us in, but we can use that to our benefit and use it to educate the ladies and the women and the females around the world about the power of their body and not to be ashamed. That's my presentation. I promise to make it very quick because I would like to answer your questions. So the floor is yours.
Thank you so much, Salam. I know that you have much more details to share. This gives us a good kick off the presentation. I wanted to put you first because I think you have addressed a few of the critical points already in your presentation that are important. First of all, you just look at really tailored education approaches depending on different groups, ages, and so on. You coordinate with different actors. You make sure the gender-based violence is addressed. And you look at demand, or listen to what the needs and demand is from different from your different groups, as you just said, like for example the product options. So yeah, thank you so much. And there's already one question here from Marwa. She asked, can you explain more about withdrawing information from Islam to improve their acceptance? What did you withdraw and how was the response? Did it improve the situation?
To be honest, I don't have the text memorized. It's Quran text. But I can, if you just share with me your email, I can send you the material we withdraw, because there is a lot of material on that, and I cannot botch it by saying something that is, it's supposed to be said in a certain sequence, and I'm not versed enough to know the sequence. But I'll be more than happy to share it with you. But again, there is a lot of materials in Quran. There is a lot of materials in Hadith, which is what's been assigned to Muhammad, the Prophet, that is really beneficial, and it supports the woman in a lot of instances, especially during her menstruation. So I can share that with those, or I can share that with Inia, and then she can just share it to everyone. I'll be more than happy to share that as well.
Yeah, I would say share this with me, because I think we have a couple of people from also deeply religious or Muslim societies where they would use the similar approach, because I think that's very interesting that usually it's an argument why you shouldn't touch the subject, but you use information from the religious text to help to make your argument.
Mostly it's in Arabic, obviously, because of the religion part, but I'll try my best to translate it, and then I'll send it.
It's fine. I think we can all use Google Translate, and and if it's Arabic. So, but I want to make this available to everyone, everyone here.
Sure.
Then there's another. I think similar question was from Mihad, or like a comment that in Nigeria, it wasn't a public comment. It's also very difficult to discuss menstruation because it's not public, and also similar society, and with very deep religious notes. So can you just explain about married menstruators? Because we talk a lot about girls, but you work with older and married menstruators, like women. How did you?
Okay,
what is your
so the differentiation we make is either the female has lost their virginity or not. And I'm sorry to put it in these terms, but that's the simple truth, because girls' needs are different from women's needs. And we know this is very conservative, and it's a very Muslim, very, so if you want, Middle Eastern thing, but this is how it works for us. With girls, you cannot give them a cup, you cannot give them tampons and tell them, try this. For example, this is the simplest way to put it. With women, you can. So the needs differ, the products differ. And then when you talk about, female hygiene, female practices, it differs from a girl to a woman. So as well, we concentrate on that, because when I'm talking to a woman, I know the limits I can get to with my conversation. I know that I can say, yes, if you put this in, you put this out, you clean this way, you don't clean this way. But with girls, I need to be very careful how to say it, and etc. Plus, yes, it's a menstrual hygiene session, but at the end of the day, you will always get questions about, what if I get, for example, itchiness down there? What if I get this? What if I get that? So to be able to answer those questions for the females, you need to give them the safe space to actually do that. And in order for them to have the courage to mention this, you need to make the separation, because there is no one married woman that I've met that is willing to talk about those subjects in front of a girl, and vice versa. So you need to create this safe space. And for them, safe space is this separation. And it might not make sense in your community, but in our community, it makes sense. So this differentiation gave the girls and the women the safe space to talk, to ask the questions that they really needing to ask. And of course, if they need the health referral that should be done, or whichever referral that needs to be done, then it would be done. But otherwise, you will not break this ice. You will not allow them to speak freely. I hope that explains your question.
Yeah, I think it's like you catch people in a different age and different needs and interests. There are two questions regarding why you recommend not to combine MHM sessions with sex education. One starting talking about the physiological process. It's so connected to sex education. So yeah.
So we only don't talk sex education with girls because, again, as I said, with women, it's easy, and they will direct your conversation by them asking you the questions. And that gives them the liberty to be as free as they want with the information they're willing to share, and the information they're willing to take from you. With girls, that's not the case. Plus, if one of the girls goes and says, oh, the lady told me this and this about sex, forget it. You lost trust. There will never be another girl in your session, and it will be a lot of problems on your reputation. And you don't want that, because yes, I can explain to her about sexual education in very discreet manner, etc. But the moment one information, oh no, this lady said this instead of this, it's a big issue for us. So I'd rather not have this conversation at all with the girls. With women, again, they lead the conversation, and which is great. They always go into that direction, and I always let them. But with the girls, it's a very conservative place. You don't want to be misunderstood. You don't want to be looked at as you're encouraging sex, or you're encouraging knowledge of sex, because it's not something they want their kids to know about.
Thanks. Again, like very age different, and also be sensible to the community. There's another question about you offered yoga. So was it a request by the participants, or and do people in Lebanon in general practices, or was it just did you choose it because it helped people? So can you elaborate on this?
So obviously we tell them about the hot pack, etc. You know, if it's too bad, the medication. But as well, we like to offer the alternative solution, which is yoga. A lot of girls tried it and it helped. So we taught them very basic stuff, you know, and it helped. So we sometimes participate in it. All right, I'm gonna have to apologize. I really need to go. I'm on a meeting as I agreed before.
Yes,
please, if you have any more questions, just send them to my email and I will be more than happy to email it to you. Good luck, everyone. Hope you have a good day. It was a pleasure.
Thank you, Salam, for being here. There's also one or two more questions that I sent you afterwards, and you helped to reply. That's why thank you anyway for being here, despite having to run off. I'm sharing my screen again. And we wanted, as I said, I wanted to kick off because Salam has a lot to share on different experiences, different stakeholder groups. They celebrated MH Day. And again, if you have questions, please type them in the chat box. We forward them to Salam and she makes sure to reply this. And we also put all the answers, if this concerns to everyone, into our summary of the session. As our next speaker, I want to welcome Jolie UCAYA. She's the Assistant Technique in the region for Malteser International in the Democratic Republic of Congo, already since 2016, so almost 7 years. She works in 2 provinces that she will explain to you soon, with schools and refugees from South Sudan. Bienvenue à Jolie. Elle est l'assistante technique périphérique WASH chez Malteser International depuis juillet 2016, so environ 7 ans. République démocratique du Congo. Elle travaille dans 2 provinces, dans le volet WASH, dans les écoles, et aussi des réfugiés du Sudan du Sud. Okay, over to you, Jolie. I'll share your presentation, and then we have also Cécile, who will help you with the translation. Et voilà. Can you see the big? Yeah. Okay. I can see it. Wait, give me a second. I need to. Over to you, Jolie.
Ok, merci. Bonjour à tout le monde. Comme elle vient de me présenter, nous passons directement sur le sujet éducation des enfants filles et l'expérience dans la communauté. Nous sommes dans la République démocratique du Congo.
Excuse me, Jolie,
comme vous voyez la carte.
Just take a second to repeat what you just... pardon, Jolie. Je vais juste répéter ce que vous venez de dire pour lancer votre présentation, si vous le voulez bien. Good morning to everyone.
Presque.
Thank you. And we're going to enter straight into the topic of education of girls at school and experience of education within the community.
Ok, merci. Deuxième diapositive. Là, nous allons voir la République démocratique du Congo avec différentes provinces dans lesquelles nous travaillons, comme nous le voyons ici sur la carte.
Now we're going to enter straight into that topic with the presentation of the Democratic Republic of Congo and the 4 provinces where we are currently working.
Nous sommes à Baswele qui est ici sur la carte, Haut-Uele, Ituri et Kasai central.
So we are located in Baswele, Ozwele, Utiri, and Kasai Central that you can see on screen on the map.
Okay. La gestion de l'hygiène menstruelle est intégrée dans 2 provinces, en Ituri et à Haut-Uele. En Ituri, nous sommes dans des écoles. À Haut-Uele, nous sommes aussi des réfugiés et aussi dans des écoles qui hébergent les enfants des réfugiés sud-soudanais.
So the management of menstrual health is carried out in Ituri and Huwele regions. In Ituri at school and in Owele, we work both at schools and also with the refugees and with the girls that are part of the refugees, notably in the region.
OK, dans la zone de santé de Aba à Haut-Uele, là, nous avons 7 écoles et 2 sites de réfugiés. Tandis qu'en Ituri, nous sommes dans 20 écoles dans la zone de santé de Adi.
In the la première partie, c'est le Bawele, c'est ça que vous m'avez dit, madame? Pour les 7 écoles?
Haut-Uele.
Sorry.
Oui, Haut-Uele, 7 écoles, 2 sites de réfugiés.
So in the Owele, there are 7 schools and 2 sites with refugees. Where in the other area, the Bawele, we have 20 schools where we have children from refugees as well, refugees children.
Diapositive suivante. Là, nous allons voir la situation humanitaire en RDC Congo.
Now we're going to speak about the humanitarian situation in the Democratic Republic of Congo.
Okay. Des milliers de personnes ont été forcées de fuir les foyers et luttent maintenant pour leur survie. Les dernières données datent du février 2023. La RDC accueille 522 000 réfugiés et demandeurs d'asile, dont la majorité, entre 74%, vivent en dehors des camps de réfugiés ou des colonies. Source OCHA RD Congo.
According to the OSHA RDC Congo source, thousands of people have been forced out of their household and are fighting for their survival today in Republic Democratic of Congo. According to the latest data from February 23, there are in the Republic of Democratic of Congo 522,000 refugees and asylum seekers, a majority of which, 74%, live outside of the colonies and refugees camps.
La même province en Ituri connaît une recrudescence des sida sécuritaires depuis le mois de mai, notamment dans les territoires d'Irumu et de Ndjougou, et s'étend sur le territoire de Magui et de Aru. Ces contextes d'insécurité impactent l'espace humanitaire et exacerbent les vulnérabilités de la population. C'est toujours la même source OCHA Congo qui fait que la province de l'Ituri n'est pas stable.
According to the same source, the Ituri province is not stable because it has been witnessing an increase in the security-related incidents since last May, notably in the territory of Irumu and Jugu, and it's now extending to the Mahagi and also the Aru region. So this context of insecurity is impacting the humanitarian situation and is making the people more vulnerable.
Le projet WASH scolaire et la gestion de l'hygiène menstruelle a commencé dans cette région depuis 2019 jusqu'à aujourd'hui.
In this context, the WASH project in schools and the project of management of menstrual hygiene has started in this area since 2019 and is going on up until today.
Dispositif suivant. Contexte et justification. La gestion de l'hygiène menstruelle est un problème très sérieux rencontré par les élèves et filles qui ont leur menstruation et a longtemps négligé par les acteurs de l'eau, hygiène et assainissement.
In this context, the management of menstrual hygiene is a serious issue, a serious difficulty for the girls at school when they are menstruating. And this has been neglected for a very long time by the water, sanitation, and hygiene officers.
Briser le silence sur les tabous menstruels est une réelle préoccupation pour des milliers d'élèves, filles et la communauté dans laquelle elles vivent.
So breaking the taboo on menstruation and the silence around menstruation is a real important concern for millions of schoolgirls and for their community.
Suivante diapositive. Éduquer les élèves filles sur la GHM, toutes les adolescentes ont droit à l'éducation sur la gestion de l'hygiène menstruelle.
So educating the schoolgirls on menstruation, hygiene, management is important. All teenagers, all girl teenagers have a right to education on MHM.
Cette éducation aide les adolescentes à sortir de l'ignorance sur les tabous menstruels.
Education helps girls, teenagers, breaking the taboo on menstruation and breaking ignorance.
Les libère aussi de la peur, des mythes et des croyances liées à la menstruation.
It also frees them, it makes them free from the myths and the fears and the traditional beliefs around menstruation.
Leur donne le sang-froid, le courage de discuter entre elles et dans nos réunions sur la menstruation sans problème.
It also gives them the stamina to discuss between them and to discuss with us during the meetings on menstruation.
Les aide à maîtriser la transformation et le fonctionnement de leur corps, y compris le cycle menstruel.
Education also helps them having control on the transformation of their body and on the functioning of their body, and also it helps them understanding menstrual cycles.
Suivante diapositive. Éducation sur la GHM avec les guides pédagogiques Le Monde de Rosalie.
Now I would like to speak about MHM education with the Roses World Guide, educational guide.
Cette guide est tellement pratique et très excitant pour les élèves.
So this guide, Le Monde de Rosalie in French, is very exciting, very easy to use, and the school people love it.
Et très adapté, motive l'auditoire lors de la séance.
It is very adapted to the audience. It's very motivating for the children during the education sessions.
Comme vous le voyez sur les images ici, lorsque chacune se dessine elle-même, dessine tout ce qui se trouve sur son corps, donc elles sont motivées à le faire avec beaucoup de courage.
And as you see on the picture, every child, every pupil loves drawing the body and doing it themselves. They are very motivated and happy to do it.
Et suivant. Comme vous le voyez, l'histoire de Rosalie est la ménage. L'histoire de Rosalie nous a facilité la tâche d'introduire la ménage et l'arrivée des premières règles chez les adolescentes.
So Rosalie's story helps us. It's an example, and it helps us explaining the arrival of menarche, the first periods in the life of a girl.
Comme vous le voyez sur les images ici, ce sont OK. Ici, ce sont les filles réfugiées sud-soudanaises non scolarisées, tandis qu'ici, nous sommes dans des écoles.
On the left, you can see the girls. They are refugees and they don't go to school. On the right-hand side of the screen, on the contrary, you've got girls at school.
Suivante. Les résultats de nos activités sur la gestion de l'hygiène menstruelle. Depuis 2018, où le programme a été lancé dans des sites de réfugiés du Sud-Soudan à la province de Haut-Ouélé, zone de santé de Abba, nous avons 810 jeunes filles non scolarisées et 427 filles scolarisées qui ont reçu la formation. La tranche d'âge était de 8 à 17 ans.
Since the beginning of the project in 2018, when the program started in 2 refugee sites in the South Sudan, in the province of Howele, 810 young girls have been trained who are not at school, and 427 schoolgirls have been trained. And the age bracket was girls between 8 and 17 years old.
OK, pourquoi nous avons pris 8 ans là? Nous avons été surprises au site des réfugiés, une jeune fille de 8 ans qui avait eu sa menstruation, raison pour laquelle nous avons repoussé à l'âge de 8 ans jusqu'à 17 ans.
Cécile, you are muted.
Why did we start as early as 8-year-old? Because we were surprised to discover that one of the girls in the camp got menstruated as early as 8. So we decided to start the training for girls from 8-year-old on.
Merci Cécile. Depuis 2019, où le programme a été lancé dans 20 écoles de la province de l'Ituri, dans la zone de santé de Adi, nous avons déjà formé 7960 élèves filles, 267 enseignants et la tranche d'âge était de 10 à 17 ans. Nous avons aussi formé 467 élèves garçons et 297 hommes ont été sensibilisés lors de nos 3 séances sur la célébration de la Journée mondiale de l'hygiène menstruelle. Ils ont été sensibilisés sur cet événement de gestion de l'hygiène menstruelle.
And since 2019, when the program was launched in the 20 schools of the province of the health area Ituri from Adi, 7,960 schoolgirls have been trained to MHM. 267 teachers have been trained. For the girls, it was between 10 and 17 years old. And also 467 boys at school have raising awareness campaign, and 297 men as well have received awareness campaign within the framework of our 3 sessions of raising awareness campaign during the MH Day celebration.
Difficultés rencontrées chez les adolescentes et dans la communauté. Première difficulté, le tabou sur la menstruation. Tout le monde connaît qu'il y a la menstruation, il y a la règle, mais personne n'en parle.
So what are the difficulties we meet with the teenagers and the community? Well, the first thing is the taboo on menstruation, because everyone knows it does exist, but no one wants to speak about it.
Accès limité aux services de conseil et d'orientation. Et les parents et les enseignants, personne n'avait le courage d'orienter et de conseiller les adolescentes que, en grandissant, il y aura la menstruation qui les attend dans leur vie. Donc, personne n'en parle.
There is also the issue of the limited access to advice and recommendations, meaning that neither the teachers nor the parents explained to the girls what was going to happen to them and what to do.
Croyance c'est la tradition, donc elles croient à ce qu'ils ont attendu et la peur des mythes. Par exemple, une fille nous a donné un exemple, elle disait que si une fille pendant la menstruation traverse une rivière, la rivière va tarir et elle croit à ça.
And there are also traditional beliefs and fears that are really legends. For example, a girl told me that she had been told and she was convinced that if she was to cross a river when menstruating, the river would run dry. And she was really convinced it was true.
Il y a les coûts de serviettes hygiéniques commercialisées. Donc, les parents qui vivent journalièrement avec peut-être $2 de coût de vie ne peuvent pas être capables d'acheter les serviettes hygiéniques à ces 2 ou 3, 4 filles qui ont leur menstruation. Donc, c'est un peu difficile.
There is also the issue of the cost, because the sanitary towels that you find in the shops are much too expensive, so that the girls can't have them. It's difficult to buy for the family to buy it for the girls as well.
Il y a une adéquation des installations servant à gérer les produits. Nul n'ignore que toutes les femmes et les filles ont besoin d'un endroit bien sécurisé pour s'échanger, car personne ne veut qu'on sache qu'elle est pendant la menstruation. Alors, il faut vraiment bien gérer leur intimité. Nous allons trouver que dans des écoles et même à la maison, il n'y a pas d'installations bien appropriées pour s'échanger les serviettes hygiéniques, raison pour laquelle les enfants veulent rester à la maison.
Another important issue is the fact that the facilities are not adapted for the management of menstruation. The girls, the women, need a safe space where they can have intimacy and they can get changed safely. And very often they can't have that at school, sometimes not even at home. But if they don't have it at school, that's why they are not going to school, because they don't want to be seen and they don't want people to know that they are menstruating.
Accès à l'eau et au savon disponible au niveau de l'école et aussi au niveau de la maison. Nous savons très bien que pendant la menstruation, une femme ou une jeune fille pendant ses règles a besoin de l'eau à quantité et à qualité pour arriver à satisfaire ses besoins pendant la menstruation. Se laver le corps, laver ses matériels, tout ça, ça demande de l'eau. Vous allez trouver, il n'y a pas de l'eau à l'école, il n'y a pas de savon. Alors, elle est vraiment déstabilisée. Elle ne peut pas aller à l'école parce qu'elle n'est pas à l'aise là-bas.
And also, the girls need water and soap in sufficient quantity, because clearly during menstruation, the girls need the quantity and quality of water to wash themselves, to clean themselves, and to wash the equipment as well. If they can't find it, if there is no water at school, then they are unsettled and they won't go to school.
Comment nous avons surmonté les obstacles menstruels? En organisant l'Assemblée générale des parents des élèves, envie de briser le silence sur les tabous, envie de leur parler sur le bien fondé de la gestion de l'hygiène menstruelle à l'école.
How did we overcome the menstrual difficulties? Well, we organized a general assembly with the parents of the pupils in order to break the silence over this taboo.
Nous avons organisé des différentes formations sur la gestion de l'hygiène menstruelle aux enseignants et aussi aux élèves filles. Nous avons aussi organisé les clubs des élèves filles où les plus âgés doivent parler de la menstruation aux moins âgés et aussi de l'expérience qu'ils ont vécue pendant leur menstruation.
We have organized also training sessions on MHM for the teachers and for the girls at school as well. We have created clubs, societies within girls, so that girls themselves, eldest and youngest, can talk together, and the eldest will explain to the youngest what they have been experiencing.
En célébrant aussi la journée mondiale de l'hygiène menstruelle pour sensibiliser les hommes et les élèves garçons sur la menstruation et en distribuant les kits de dignité aux élèves filles.
We are raising awareness among boys and men through the celebration of the Menstrual Hygiene Day. And we are also circulating, giving what we call dignity kits to schoolgirls.
Thank you. Briser le silence sur les tabous, nous voyons ça pendant la journée mondiale de l'hygiène menstruelle. Les parents qui étaient contre cette activité, aujourd'hui, ils ont reçu les kits de dignité et même entre leurs mains. Et les enfants étaient tellement motivés de porter les bracelets menstruels qui étaient moins, mais chacun voulait qu'elle la porte entre ses bras. C'était une bonne chose pour briser le silence sur les tabous. Alors, nous avons aussi organisé, oui, deuxième slide, nous avons organisé cette journée pour aider aussi à sensibiliser les garçons et les hommes.
Well, we have been breaking the silence through the celebration of the MH Day, and the families, the parents who were ashamed and did not want to speak about it, at the end, they were very proud and they were so happy to have these kits in their hands and also to wear on the wrist the bracelets to demonstrate that they had understood. And that's a very important way to raise awareness also among boys and men.
En construisant aussi les blocs latrines, nous avons construit des blocs latrines dans des écoles séparées où les filles à part, les garçons à part, avec cabine de gestion de l'hygiène menstruelle. On a aussi aménagé les sources d'eau potable proches de chaque école et on a installé aussi les systèmes de collecte d'eau de pluie. On a organisé la formation sur le cycle menstruel parce qu'on a trouvé que sur 4 filles, une fille seulement a quelques connaissances sur la menstruation.
Other ways to overcome these difficulties linked to menstruations, we have built gender-specific toilets specifics to girls with what it takes to manage menstrual hygiene. We have also worked on drinking water sources near the schools so they can get the water, and we have set rainwater systems to collect the rainwater, and we also organize information trainings on menstrual cycles because we have discovered that only 1 out of 4 girls had any knowledge about menstruation.
Nous voyons ça, c'est l'image de la journée mondiale où nous avons célébré. Nous nous engageons à lutter contre la stigmatisation pendant la règle. Et nous voyons, il y a les enfants garçons et les enfants filles, tous ont participé. Et derrière et là-bas, nous regardons les blocs latrines que nous avons construits séparément, y compris aussi les cabines pour la gestion de l'hygiène menstruelle aux enfants filles.
So here you can see on screen that was the celebration of the AMH Day, where it's written that the people are committing to fighting the stigma during the periods. And at the back of the image, you see on the right-hand side, the toilets we have built with specific areas for the MHM.
Suivant. Alors, nous sommes à la fin de notre exposé. Nous vous remercions pour votre attention. Les contacts sont là. Nous remercions UNICEF vraiment pour cette initiative de Monde de Rosalie. Et nous remercions aussi Malteser International de nous mettre en contact avec UNICEF pour faire bien avancer notre activité. Je vous remercie.
Okay, thank you.
We have reached the end of this presentation. Thank you very much. Thank you for listening to me. You have the contacts there, and we want to thank the Water Association for making this possible and the Malteser International Association for putting us in contact. Thank you.
Okay. I have one question from the audience, and there was one comment, maybe Jolie, that you can answer with the help of Aya. But the one question is, what topics do you share with boys as well men?
Jolie, quels sont les sujets que vous traitez avec les garçons et les hommes spécifiquement?
Ok, normalement pour les enfants garçons, nous leur parlons des transformations de corps chez les enfants garçons et qu'ils puissent savoir aussi que chez eux aussi, il y a la transformation des corps, tandis que chez les filles aussi, il y a la transformation des corps. Parce que nous trouvons que parfois, les enfants garçons ont l'esprit de minimiser les enfants filles et d'autres en train de les marginaliser parce qu'elles-mêmes sont déjà marginalisées par les tabous. Alors, pour promouvoir leur dignité, il faut que les enfants garçons aussi savent que les filles ont même valeur qu'eux.
What we do is at first we train the boys about the idea of transformation of the body when you are a teenager, but we explain that they are changing as well. And we explain transformation for boys, transformation for girls. We want them to understand that there are changes in both sides, but they're equal. We want them to break the taboo and to understand that the girls are equal with them.
Super. Thank you, Jolie and Cécile for the translation. Merci, bienvenue. Merci pour la traduction. Il y a une question dans le chat box par Linda. It would be nice if you can jointly try to answer it in the chat box because we need to move on now to our next presenters. Which is a team, and they're both they're working in a neighbor country in Sudan. I want to welcome Marwa Tageldin. She's a menstrual health activist and expert with a diploma in sexual and reproductive health and rights from Lund University and master degree in public health from the Royal Tropical Institute in the Netherlands. And her thesis was actually on the effect of armed conflict on menstrual experience in Sudan. She's the founder of Let's Talk Period, and she will share more about it. She's joined by Mihad Adam. She's a medical student and SRHR advocate, who is also active in the Standing Committee on Sexual and Reproductive Health and Rights, including HIV/AIDS. And she also found a small initiative, Empower SD, to raise awareness among Sudanese girls and women. So over to you.
Thank you, Ina. Good morning, everyone. And today, me and Mihad, we're going to present to you our work and campaign, 1 Million Sustainable Pact. Campaign, reproductive health is a right and not a luxury. Mihad, are you there?
Yeah. Hello, everyone. I'm going to complete with you from here. So we have to know this is not the first emergency that we have in Sudan. We have several emergencies since 2019. We have going on and off due state of emergency due to the war. But we have also previous for over a decade armed conflict in Darfur on and off because of civil unrest, also pandemic and several epidemics in Sudan. We don't want to talk about this, especially this is what's happening in Sudan now. It's much larger and affecting all Sudan because it's in the capital, in Khartoum, which is the center of all services. We don't have, so when we talk about what's happening, it happened, the war in Sudan, it happened the 15th of April between the armed force and paramilitary rapid force support. It's the war now is in Khartoum and in Darfur, unfortunately. We have 7 million people have been forced displaced, 1.2 outside of Sudan, and 5.3 internal displaced in Sudan, and over 2 million are from Darfur. Next. We don't have a sexual health in Sudan, in this name, sexual health, even private or governmental, because there's a taboo and due to the religion in our country. So mainly when we talk about sexual health, it's reproductive health, and it's mainly just only family planning services. It is in 43% of our health facilities, it's just only offering sexual and reproductive health. And also we have a huge gap, as you know. There is a 60% of rural areas don't have even midwife services, unfortunately. We have, before we talk about the menstrual health hygiene, we have to know that gender-based violence is affecting it in a direct way because 4.2 now due to the war have been in risk to gender-based violence. But before this, we have a higher number. We are one of the top countries that have female genital mutilation, unfortunately, which affecting the menstrual health hygiene directly. It is 87% the prevalence, and in some states in Sudan, it's 97%, such as North Kordofan state. As well, the child marriage and the child pregnancy or like teenage pregnancy, it's very high. It's the data that we have, which is available now. It's saying it's 34, but the number is much higher than this. And the pregnancies as well, as we have child marriage, we have for sure child or teenage pregnancy. One of the cases that I know, and my case, which is a 15 years girl having her first period after her first child, and she came to the hospital. She was in shock and she was scared why she's bleeding. She think that is something health related. That's why she came to the hospital. She didn't know anything about the period, unfortunately. So from here, I will give the floor to Dr. Marwa to continue. Dr. Marwa, open your mic.
Oh, thank you, Mihad. Okay, so let's continue. What's Let's Talk Period? Let's Talk Period is an initiative that started in 2020 by us. The aim is to promote mental health and hygiene, advocate for sustainable menstruation. Let's Talk Period provides a safe environment for all administrators to discuss topics related to SRHR in general, with a specific focus on menstrual health and hygiene, because again, reproductive health is a taboo topic and there isn't any initiatives or any work done in this. So that's why we founded Let's Talk Period. So our goal is to normalize conversations about periods in public, destigmatize menstruation, and dispel myths and misconceptions. Now to our campaign, which is called the 1 Million Sustainable Pad campaign. Our core value is to empower women and girls so they can have their periods in dignity, using a sustainable product that they can reuse, and at the same time provide them with menstrual health education. We do it through fundraising, and because due to the conflicts, many people are displaced to different states. So, for example, we have a state of Darfur, which has 1.2 million people displaced, and Shamali, and so on. So we're going to be working state by state, and then we're going to be fundraising, and then working in a state. The work will be providing menstrual health education, other relevant topics based on the needs of the women and girls. And also, we're going to be sensitizing them to use reusable pads. It's not a new thing, but we're going to be rebranding reusable pads because, again, women and girls, they already use either disposable pads or cloth. So reusable pads are just similar to clothes, but they're just like more hygienic, more safe. So we're just gonna be like telling them to use reusable pads because they're like better than clothes. And yeah, so our goal is, from the name of the campaign, to raise funds to distribute 1 million reusable pads to refugees and internally displaced women and girls within the next year, while also conducting health education sessions to promote sustainable, safe, and hygienic menstrual practices. We want to empower women and girls to reach their full potential and alleviate their suffering because due to the conflict and the displacement is very hard on women and girls, especially mentally and physically. And we want to also reduce menstrual waste and cultivate a culture of menstrual awareness, equity, and dignity, because sustainable menstruation is good for the health, good for the body, and good for the environment. And here just you can see the framework of the menstrual health. where we can see the three pillars interacting: the sanitation, the education, and the products. We're going to be focusing on the education and the product, because we're not a very big campaign. We're just starting. We're raising our funds ourselves, so we can't really work on sanitation, and because it's a major, and also although we need a cross sector collaboration, but it's like out of our of what we can provide. And we can also see here that the community and the social norms and taboos, how they affect the menstrual experience of women and girls. And we want to address the social and cultural norms and taboos in our menstrual health education. As for the campaign, it's designed based on our expertise in the team, because we're all working SRHR, and we've been working in some of the IDP camps, and we have experience also before the conflict. And also the campaign was designed based on my thesis. As Ina mentioned, it was on the effects of armed conflict on menstrual experience in Sudan. Now we're in the data collection phase, and we're also doing surveys for the women and girls to know their preferences in the menstrual health education, because it's not only about menstrual health education. We also want to discuss other topics that they can relate to and they really need to know about. And also we want to know about what type of period product they're using, and are they willing to switch or to change to reusable pads. So we also want to know more about that in the surveys. So our beneficiaries are the IDPs and refugees, respected for their ethnicity and race, and we're going to be focusing on underserved populations, people with special needs, and refugees from other neighboring countries, or also IDPs like from South Sudan or Ethiopia, who were displaced from Khartoum to other parts of Sudan. Now we're also developing a training modules for TOT. So we have trainers, like they're going to be volunteering to give health education, but again, we have to train them on what topics they need to be covering and how they can mitigate the health education sessions. At the same time, in the campaign, we're also providing educational content on menstrual health and hygiene, and we're collaborating with different CSOs. Yeah, Mihad. Thank you.
So the challenging that we have, as before, Dr. Marwa mentioned, the fund, it's the biggest challenge that we have as well for the awareness. The data collection, because it's taking time and effort, and we need a lot of volunteers. And the number of people that now they don't have a work, they don't study, they need the money. Like even if they, in a normal situation or before the war, if they can't do this voluntary, but now they need a fund to like transport from area to area to reach the people to collect the data. As well, the water accessibility is an issue due to especially in many areas. I won't say some areas, in many areas in Sudan and in many villages, they don't have like a water accessibility in their house. And yeah, and also you are going to observe to internally displaced people in the camps and shelter. We would like to reach them and focus on them. So we don't have like a certain data or the number of people, how many people that we have in the internally displaced in the camps and the shelters in Sudan, and the number of the shelters overall, like in Sudan, how many and how much, like the number of girls and women are in there. So yeah, and also the reusable pads. We don't have the still we don't have the idea or the concept of using it, because many people think it's difficult to washing it and how, when, where they can put it and hang it into and cleaning it. It's a difficult process for many, and yeah, this is why they prefer to use the reusable pads, which is expensive. So introducing the idea of reusable pads is going to be a little bit challenging. Next. So the recommendation, that we need to do for this campaign is the menstrual dressing, social, cultural, and culture taboos and norms. Talk about this, about the idea of, and talking about menstruation overall and menstrual hygiene. Introduce this topic to the society and to the girl and woman. As well, we want to consultation and survey menstruator needs, which is going to do this by the data. Still, the issue that we have, female staff and capacity building to capacitate the volunteers that they are going to work with us. So where we can meet them, the internet situation, the trainings, the material, preparing the material, it's also challenging, and you are working on it. And yeah, that's it. So Marwa, do you have any further thing you want to add?
Yeah, as you mentioned, and just one point about the female staff, because again, SRHR is a very taboo and stigmatized topic. That's why we're focusing on the female staff, because women and girls can be more receptive from other women and girls than male staff. And you can always support our campaign. The official launch is going to be next week on the 12th of December. We have a GoFundMe and PayPal link, and we're open for questions if you have. Thank you.
Thank you both. And it's exciting to look at your launch next week. And you have big plans that you laid out. And I especially like that the campaign is really based on needs and discussions, and your foundation that you did with the research. There's actually a question, very same from Linda and Celine. How many pads do you give out to a girl, and have you considered making reusable pads themselves because of more of like even more sustainability and maybe lesser costs locally?
Yeah, so we have thought about like teaching women how to sew cloth pads, and so they can sell them, and it could be like a source of income for them. At the same time, they can use them. But for that, we need more like stability in the country, and it's not really very stable for now. And so this is the second phase of our project. For now, we're collaborating with a Salam factory, which is the first factory in Sudan to make reusable pads, and they're making them with a very reasonable price, and they're gonna be giving us a discounted rate. So they were supposed to be launching in May, but unfortunately the war started in April. But now they still have like a big stock of pads. And this is what we're going to be working on. And we also discussed with them for the next phase, they can be like training and supervising women and girls. So for each woman and girl, we're going to be giving them a packet that have 3 pads as a start, so we can cover as much as possible, and then again we can come back and give. And also I want to also mention that there are other initiatives that they also fundraise, but they distribute disposable pads. So we're the only one that's like now we're gonna be distributing reusable, because we believe in sustainable menstruation, and also we want to not be coming back every 2 or 3 months. Yeah.
Thank you. That was a very helpful response, and I think there are a few experts also in terms of pad making that you can reach out to. But yeah, unfortunately, what you explained is this crisis context is making it very difficult to plan and proceed. And I think that's unfortunate for a lot of people working in emergencies. There's also a question by Linda that goes to you and Jolie. She wants to learn more about how long the training is, and if you include sex education. Maybe you can answer this in the chat box, because you also have a question from our next speaker, from Jane, because you already mentioned that you want to consider working with people with disabilities. Can you provide already some more details what you're planning to do?
So we have not really planned the details for that, but through our data collection, we know that there are like some camps for people with disabilities and camps for immigrants or Ethiopian population and one from South Sudan, and they're not really served. So we want to focus on giving them health education and giving them pads because from data collection, there are like some camps that are being visited multiple times by different NGOs and other camps that are not. So we want to focus on the underserved. And of course, because this is like a community work that we're doing and we're reaching out to many people and many people are giving their help and their expertise. So we're sure like we can find someone who can be, who are willing to guide us on how to approach people with disabilities and special needs.
Okay, and that's a very, very excellent transition to the expert on working with people on disabilities. I'm very, very glad that we have Dr. Jane Wilbur here with us today. She is an assistant professor at the International Center for Evidence in Disability at the London School of Hygiene and Tropical Medicine. And she really brings in 20 years of experiences in expertise in working with disabilities, water, sanitation, and hygiene, and really experienced in designing, implementing, researching, evaluating disability inclusive research, especially in the menstrual health space, like in the humanitarian setting and in the development setting. We also know that last week was the International Day for People with Disabilities. So it's highlighting as well that this is an issue that we really need to look at. Yeah, over to you, Jane. I'm kicking off. I know this is a really interesting presentation for all of us.
Thank you. I couldn't find my unmute button, but thanks very much for that introduction, that lovely introduction. So I'm going to speak for 15 minutes, and it's about improving menstrual health for adolescents with disabilities during emergencies. So I'll start with a bit of background, just in case people aren't aware of this. But disability may be more common than you think. So 1 in 6 people globally have significant disabilities. And about 119 million adults with disabilities rely on caregivers. And nearly 80% of people with disabilities live in low middle income countries where they face barriers accessing WASH, health, and SRH, sexual and reproductive health services. And of course, we know that humanitarian situations can increase disability, it can worsen people's disability. So there's a cycle within humanitarian settings as well. So of the global population, about 12 to 18% of women of reproductive age have disability. And there's a widely held misconception that people with disabilities don't have the same reproductive systems as those without disabilities. So they're less likely, well, there's a belief that they don't menstruate. So within the context of menstrual stigma, where there's a lack of accurate information, people with disabilities are even less likely to receive that. So for instance, people with disabilities are 20% less likely to know about menstruation at menarche than those without disabilities. And research that we've done in Vanuatu shows that people with disabilities are nearly twice as likely to miss out on social activities when they're menstruating compared to those without disabilities. And there are very, very few interventions that support menstrual health and hygiene of women and girls with disabilities. And those that do exist often exclude people with disabilities. So, for example, very few children with disabilities are in school, and many menstrual health interventions are delivered through school, so they're missed out of that dissemination route. My research in Nepal and Vanuatu, which focused on menstrual health for people with disabilities, showed that they face the same challenges, but they intensify for people who are reliant on caregivers for their menstrual health. So many of these people will have an intellectual or a physical disability. And the challenges faced by caregivers are huge. They have no support or guidance on how to support another person's menstrual health. Caregivers often or sometimes resort to physical restraint, so tying people up so they don't leave the home when they're menstruating, isolating them or even sterilizing them because of the menstruation, but also because of a fear of unwanted pregnancies. So it's a very complex issue. So moving on to our study, it's called Shifting Humanitarian Norms. And within this context, the background that I've just shown, World Vision Vanuatu and the LSHTM received funding from ELRA's Humanitarian Innovation Fund to conduct research to explore menstrual health experiences of people with intellectual disabilities in Vanuatu's humanitarian setting, and also to adapt, deliver, and evaluate an existing menstrual health behaviour change intervention for people with intellectual disabilities in Nepal. And that was adapted to Vanuatu's humanitarian context. So this is Vanuatu. It's in the Pacific, it's northwest of Australia, and it's a collection of 83 islands with just under 308,000 people spread across all these islands. It makes this makes Vanuatu a very expensive country to deliver interventions in, but it's also the world's most at-risk country for natural hazards. So this includes cyclones, earthquakes, flooding, volcanic eruptions. So in that sense, it was a good setting to carry out this study. Now, we started by analysing existing evidence to understand the inclusion of disability in humanitarian settings within menstrual health interventions. So this covered all impairment groups. We followed that up with qualitative research in Vanuatu to understand the specific experiences of people with intellectual disabilities and their caregivers in Vanuatu's humanitarian responses. These publications have been written at open access, so they can be downloaded on the slide. And I'm not going to focus on the findings in this presentation. I'm going to focus more on the intervention. So after analysing the findings from those two stages, we adapted the Bishesta campaign. Now, the Bishesta campaign, you might have heard of this, you might have heard me speak about this in the past, but it's a menstrual health behaviour change intervention for people with intellectual disabilities and their caregivers in Nepal. But importantly, that's within the development setting, so not the humanitarian setting. I developed that with WaterAid and I evaluated it. And the Bishesta campaign had positive impacts on people with intellectual disabilities. So that's why we adapted it for the humanitarian setting in Vanuatu. This presentation, if you've heard me talk about the Bishesta campaign, might be similar, but I'm going to highlight how we changed it for this new setting. So moving on to the Ve Vanua campaign, which is what the campaign in Vanuatu is called. So here are the faces of the campaign. There's Ve Vanua on the left. She's wearing purple and yellow, which are the campaign colours. And her caregiver, Votuhe Vanua, is standing behind her. Now, each group, we have young women and girls with intellectual disabilities, and I'm going to call them young people person from now on, and their caregivers. They each have target behaviours. For the young person, it's to use the menstrual material, use pain relief, and don't show used menstrual materials in public. For the caregiver, it's to provide enough menstrual materials, provide pain relief, and show love and emotional support. So we delivered the campaign to 30 young people and 35 caregivers living in the Sanma province in Vanuatu. And the facilitation team included a person with a disability themselves, a woman with disability. And during the delivery, the country experienced COVID-19 and 2 cyclones hit the province. So it was very much testing it in a real situation. It was realistically tested. Now, I'm just going to highlight the key adaptations that we made from the Bicester campaign to the Vevanwa campaign. So we slightly revised the target behaviour, we reduced and simplified the handouts. I'll explain what they are next, but that was to reduce costs. We revised all the visuals to suit the socio-cultural context of the humanitarian setting. So this was cyclones. We depicted men and women providing menstrual health care and support, because in our qualitative research, we found that both men and women provided menstrual care to people with intellectual disabilities. We also piloted period underwear and reusable menstrual pads. The period underwear was outside this research, so I'm not going to present on that, but I can answer questions at the end. We delivered it house to house instead of group settings, because people weren't comfortable asking questions about menstrual health in groups. And we also, through the delivery, we involved women and men caregivers so that the whole family could support the menstrual health of young people. So there were campaign components that we handed out, and these are designed to trigger the behaviour change, but also to make them easier to carry out. So, for example, we have the reusable menstrual pads at the bottom. They are stored in the yellow storage bag. That's the one on the right. And there's also a bin. That's the photo on the yellow storage bag is on the left and the bin is on the right. All those things should be put next to the person's bed and full at all times, so that they always know where they can get a clean menstrual material. On the top, there's a small drawstring bag. So if they're leaving the home and they're on their period, they can take clean menstrual material with them. Our research, so this is some images from a visual story that we developed for the setting. The image on the left, this is Vevanwa's dad showing her, explaining to her where that she can get clean menstrual materials in the yellow storage bag. The next image is of the family evacuating in a cyclone, but you see that Vevanwa is taking her menstrual storage bag and her bin with her. The next image is of Voto Vevanwa, so the mum, showing Vevanwa how to put a menstrual material in her underwear, and then explaining that it's a normal part of puberty, it's part of growing up. And finally, mum and dad reiterating to her where she can get clean menstrual materials. In the training, we used a Vevanwa doll to teach young people about menstruation, so how to put a menstrual material in underwear, how to dispose of it, and then how to dress the doll again. Each young person was offered a small doll to take home so they could then practice changing the menstrual material when they themselves weren't menstruating. So moving on to the evaluation findings, this was a feasibility study. So the Vevanwa campaign was considered feasible and acceptable for the young people, caregivers, facilitators, and practitioners. And we did see improvements across all target behaviours, but many young people said that, or expressed that they were managing menstruation more independently. And a female caregiver, I've used pseudonyms throughout this presentation, but a female caregiver said the last month was the first time we slept and she went to the toilet and she saw her period and took her towel and went to bathe. I saw a big change in her. It was the first time ever. It's helping her now. Male and female caregivers said that they could better support young people to manage menstruation as independently as possible. A male caregiver said when they're running this training, they were discussing women's sickness, menstruation. And so I learnt things that I'd never learnt, that I never knew. And it's helped me. If sometimes her mother is not there, I can. So that shows that men really did value this increased understanding so that they could support the young person as well. Caregivers and young people expressed feeling more prepared for the next emergency. A male caregiver said, "It seems small, but taking these things with us in an emergency helps us so much, so much. The feedback helps us as mum and dad, but the family too." So we began to see benefits beyond the young person. It was benefiting the whole family. We did photo voice in the feasibility study, and 2 young people did photo voice. And this is where you give a camera to a person, you ask them to take photos of, in this instance, how they felt about the campaign, what they learned, anything really related to their feedback on the campaign. And Josephine, that's a pseudonym, said that she self-directed this portrait on the slide. And she's moving from one place to the other, and she says, "I'm going to a house to hide in case a cyclone comes." So here she's taking the menstrual storage bag full of menstrual materials with her. The photos on the slides, they are owned by the people who took them, so please don't use them without contacting me, and then I'll need to get in touch with the participants to check they're happy with that. Now, we also thought about how to incorporate the Vanuatu campaign in different stages of the Vanuatu's disaster preparedness plans. Now, through the interviews with key informants, with caregivers, with World Vision staff and young people, my colleague Chloe Morrison and the team in Vanuatu came up with this flow diagram. So in terms of preparedness, the campaign you could pre-position period packs. So that would be the menstrual material bag, the bin, the visual story, pre-position them in crates ready for an emergency. Importantly, raise awareness of humanitarian actors and organisations of persons with disabilities about the importance of menstrual health for people with intellectual disabilities in emergencies. Train actors to deliver the campaign, but also deliver it at the same time. So there's an understanding before an emergency of what the campaign is. And then in the immediate response, distribute the materials, the period pants, and then long-term recovery, deliver the campaign again, repeat the awareness training and activities from the preparedness stage. So in summary, the Ve Vanuatu campaign worked in this context. Since delivery, World Vision has trained Vanuatu Society of People with Disabilities to deliver the campaign with funding from UN Women and the New Zealand government. So they're scaling that up, which is amazing, it's wonderful, but it should go further. There are global priorities for research questions on WASH and humanitarian emergencies that have recently been published. Disability and menstrual health came second and fourth out of those priorities. So it's really important that this intervention, this campaign, is adapted for a different setting, following the same research plan and activities. If you'd like more information, we've published a Frontiers of Sanitation publication. It's on the Sanitation Learning Hub. And there are many publications that I'll show on the next slide. I wanted to finish off with this self-directed portrait from Faylin. She's looking at her mum holding hands, and she said, "I like to spend time with my mama." And this is the human side of Leave No One Behind, which can sometimes get a bit lost. So I wanted to finish off with that image. Thank you very much.
Thank you very much, Jane, for this very excellent presentation. And I think you really draw the connection between a development setting, because it works in Nepal, bringing it over to humanitarian setting in Vanuatu, just really making the case that education for people with disabilities should be a priority, should not be, no one should be left behind, and that it is possible. Also thinking on preparation, implementation, and disaster preparedness, not only when disaster strikes. I want to pull out Michael's question. but highlighting that there's a question from Bhavana to everyone who works with reusable pads about washing reusable pads in a school setting. So please feel free to answer Bhavana. But Michael's question is about, have you considered using digital devices to support with visuals and interactivity in MHM training for young persons with disabilities? Or do you think such formats could be helpful to scale awareness campaigns?
Yes, I haven't done much work in that. I haven't explored that. It's something that the digital world is very much taking more of a center stage within menstrual health interventions. And I would be interested to exploring that in more detail. I think that we would just need to be careful to make sure that they are fully accessible for people with different impairment types. So you'd really need to think and do some research into, can people use them? Can they understand them? Do the images depict people in their entirety, not just people with physical disabilities, for example? Does the information meet caregivers' needs? But importantly, do people have smartphones, or do people have a device that they can use this? But thank you. It's an important point to raise.
Yeah, I like that too. I have a question, if I may ask. So for your target behaviors, it was interesting to see that you picked the third target behavior for your beneficiaries, for the people with disabilities, about not leaving their used pads around. So it was interesting that you picked this one among the three. And is there also, so I was wondering, do you explain with them in detail the menstrual cycle, that it comes again, or is this like more information that the caregiver needs to know? I'm just like, because we tend to overload people, like girls, with information, and to filter out what is essential I found this very interesting. So I was curious to know why you picked those and not others.
Yeah, so the target behaviours were picked based on what was happening in the formative research, so the qualitative research. So not everybody was actually using a menstrual pad. So that was something that we had to promote. So it was how to put it in your underwear and then to dress again. So very, very, it's totally boiled down to the essence. And then the pain relief. So not everybody was using pain relief, or people were overusing paracetamol. So there was work with the caregivers to understand different options that they could use: massage, warm hot water bottle, drinking warm water, for example. I like the yoga example in the first presentation. And then the last one, don't use menstrual materials in public. So people with intellectual disabilities, they don't always understand the social norms. Now, we don't want to reinforce them. We don't want to say that menstrual blood is dirty. If you leak, it's a problem. But people in Nepal, less so in Vanuatu, but they were being abused, physically abused. And then because they might go out not wearing a menstrual material, and then they had blood on their clothes. So it was really a safeguarding issue to promote: put it in the bin, put it in your bag if you're out, put another one on. So it was very much wear one, know when you need to change it, dress yourself once you've changed it, put it in the bin, and wash it and wash your hands with soap and water. So it was very much that. And it was done through role plays, using the doll, very much experiential learning.
Thanks. I think we can discuss longer, but we're coming almost to an end of this webinar. I'm Jane, there's one or two more comments for you in the chat box, but we'll make sure that with the notes, we'll also share the link to the report and to link to your formative research. And now it's over to you, my dear friends, who still stayed on. I'm excited that the interest in this webinar was so high that you're all there. I wanted to learn, open the floor now. Sorry, just some technical difficulties here. To hear from you about your additional recommendations and good practices. As I mentioned in the beginning, the idea of this webinar is also to contribute to a two-pager by the MHM in Emergencies Working Group that they developed for the WASH sector, for the gender-based violence sector, for the SRHR sector, but also for the education sector. And yes, this is a little bit structured, but I wanted to put your mind into looking at recommendations, not so much into challenges. And if you have tools that you want to work, that works and you want to include in this paper, or recommendations for how to coordinate across sector, how to design and implement education interventions in the humanitarian settings. I want to open the floor now for the next 10 minutes for you to share. We have 10 minutes. So I would open the floor to anyone to raise who wants to share their good experiences and practices and recommendations across these categories. Please raise your hands and then we'll make sure to unmute you, and please keep yourself short. But we want to learn from you, so that's why we open the floor now. If you still have questions to the presenters, you can also always use the chat box. Anyone who wish to share your experience working in emergencies? If there's, I will ask, I mean, you can always share your experience also after this webinar with us. So they will contribute to this operational two-pager. Maybe it's also a bit too structured. So let's do it a bit more informal. Anything that it's on your heart that you wish to share, or a question that you still wish to ask. You can raise your hands, and yes. I think these are our friends from Syria. Please unmute yourself, and then you can share.
Yeah, thanks a lot. Yeah, Judy from Syria. Thanks a lot. Thanks a lot for this interesting session. Are you going to share any tools for the program designing, for the administration, or how it will go?
No, so the operational two-pager is collecting some very shorthand advice, and also collecting an overview of tools that are applicable. I think for me, at the moment, the best tools for program design and implementation are developed by the Red Cross. This is a really comprehensive toolkit on all different aspects of MHM, from the planning with checklists and so on. So I can really recommend accessing this tool.
Okay, thanks.
Mm-hmm. Naomi?
Okay. Good morning. Thank you, everyone. Thank you for the wonderful program. Okay, right here in Nigeria, I work with Foundation for Girl Child Mentorship and Orientation. So we created, we visit girls in poor rural communities in their schools, and we have a menstrual card that we use in teaching them on how to calculate their periods, and also to know when their ovulation is. The card is quite simple because during the COVID, some school girls between the ages of 12 to 15, after the COVID, a particular school we visited had about 27 of them that got pregnant during that period. And it was quite very unfortunate to have little girls like that getting pregnant because they don't understand their period. So our menstrual card had compartment that shows them when it's their ovulation. And so we emphasize that on these periods, on the set dates, that they should stay away from sex. Here in Nigeria, things are quite difficult. And so you see girls that even go for what we call transactional sex for pad. They don't have money for pad, their parents are poor, they have not eaten. And so somebody can just have them for little or nothing. So we have this card that we share to girls across schools. We keep printing and we keep visiting every Wednesdays and then talk to them about it. And it's been yielding a lot of positive results. But one of the challenges we have here is that many schools in these poor neighborhoods don't even have toilet facilities. There is no wash facility. And then we are hoping that over time we could have funding to be able to put up a safe place, like a toilet facility for them. They don't even have water. There are schools that don't even have water, that don't have toilet at all. But right now, the menstrual card that we are using is really yielding positive impact. They carry it in their bags all the time, so they know when the next period is coming, and so they will have to keep away because we mark the ovulation site danger. We call it the danger zone. So we tell them, don't do anything. If you want to have a diploma, make sure that on this set date, don't have anything to do with anybody.
Okay. Thank you, Naomi. Simple and effective tool. So it's almost like a calendar. Thanks for sharing. Whoops. And then we have Infinix, who also wants to share something. Can you introduce yourself? Because I think it's your phone number. Yes, you need to unmute yourself. Yeah, now we can.
Okay, all right. Can you hear me now?
Yes.
All right. I'm calling from Nigeria. My name is Jacob Langs. The name of my organization is our Youth Integrated for Positive Development Initiative. Sorry, I joined the session so late due to network because I'm right now working in a remote area. About the menstrual hygiene and health, I think the last person that spoke about some of the challenges we face here too. But then I would still talk about the issue we're facing here, which is a great challenge here. Is about breaking the silence. I think in this area of intervention, we find it very, very difficult to talk to some of these teenagers due to the fact that their parents are shy to talk to them about their menstrual hygiene. So passing the message has been kind of so difficult, but so far we've been trying as much as we could to find some of the people that they are kind of close to them, that can play with them, share their own experiences of how they started their menstrual cycle. And so far, so good. I think we are making heads up, and things are moving much better. But then we don't know if there's anyone that can share an experience that he or she have faced about breaking the silence among teenagers, so that maybe we can still use that tool or measure to also implement in our area of intervention. Thank you very much.
Thank you. I think you shared some point, and maybe I can put Alice to, if she's still around. She's from the World Association of Girl Guides and Girl Scouts, who work with peer-to-peer education in many countries in Africa. Alice, are you still there?
Yes, I am. Thank you.
You want to? I know you oversee such a large program of and at the moment even like a larger campaign. So have you any recommendations for our friend in Nigeria and many other countries how to involve peer-to-peer education, how to break the silence in the community using girls? approach talking to other girls.
Thank you so much, Ina, and for really inviting us. I can see on the call we have many of us, from different organizations. So at the World Association of Girl Guides and Girl Scouts, particularly in our member organizations that really enjoy this program, it's mainly in Africa and some parts of Asia, So what we do, we train, we identify the leaders, start off with the leaders, a TOT for the leaders, bring them together, because most of our Girl Guides groups are either in schools, either in schools or in formal, groupings, and they have team leaders. So we have that first cohort of training. And once that is done, the next set of training will be the girls. So we identify girls, who are either in senior high school or just about to complete school, so that now that's the next tier, the next level of training. So these are the girls now who recruit their own peers and cascade the training. So the teacher or the guider is not directly now involved, so that the girls are freer to ask questions, freer to also discuss their fears, the taboos they have heard about. And in the end, the teacher will now just come in and summarize some of the highlight points that they need to remember, and allay any fears around menstruation and taboos. So that's how we conduct that trainings. Yes, and really making use of the Rosie's World and Ruby's World in the Asia, in our Asia, countries.
Yeah. So reiterating, finding your champions, and then building the strength of champions, give them simple tools, and then they will reach out to others. I think it's also important to be always a good role model. And I think this is the young leaders, but also you, if it takes a while, but if you create a safe space, then they will come with more and more questions. I think we heard today from different approaches, like from door-to-door activities, from Malteser, who started with educating parents first before going to schools. We heard from Lebanon that they're really dividing the groups according to age and experience. So there's a wealth of experience or simple tools, as was shared in Nigeria. There's simple tools. It takes time, but you will surely find ways into the community. I know that we're now about time, and the 2 hours went in a fly, and you're still there. So I keep the microphone still open for 10 minutes, and just wanted to say what will be, and we can continue the discussion, but I still we will do a survey with all participants. We'll do it after the webinar, what topics we should focus on in the coming two to 3 webinars, but also what practices you are interesting to share. So we heard already from Annie that she has interest in looking at the usage of cups, and that could be one topic that we want to continue sharing in the next sessions. But I still want to keep the mics open for another 10 minutes, so you'll you can share your suggestions, recommendations, and questions. I see a member from Anugraha organization has her hands up.
Hello.
Hi.
Hello. I'm Dr. Shankara Venpetkar from Anugraha organization in India. I'm from Karnataka. Karnataka is the place. We are establishing our NGO since 13 years. We are working about menstrual hygiene management program in our NGO. We are distributing so many sanitary pads to the underprivileged girls, those they are situated in the slum areas in all over India. Nowadays, the girls can't open up and they can't talk with menstrual periods about periods. That's why we are thinking that to go to the doorsteps, and we will educate them what is the menstrual cycle, how it happen, what is the biological changes is occur in the body, what is menarche, what is post-menstrual periods and all. We should educate the girls and women in the rural area. Already we are distributing dignity kit. Dignity kit, it contains 1 year pads, 1 year sanitary pads, along with 5 undergarment, with 5 soaps and 5 detergent soaps. We are distributing in our organization throughout Karnataka.
Okay, sounds good. And any recommendations? I mean, now you explained the activities that you did, but what is the learning that you want to share with others? What can others learn as a good practice from you? Like really a recommendation that makes your activities a success.
Yes, I need more training programs to do more knowledge. We get more knowledge. 100% we will share the knowledge to the rural area. Those are underprivileged girls.
Okay.
We need. Yeah.
Thank you so much for your insights.
Another one small request. Better you do the Zoom instead of Zoom meeting. We go for Google Meet. Google Meet is the best platform to easily we can. There is no disturbance at all.
I'll pass this on to the German Wash Network who host this, but
yes, because Zoom Meet, some network issue is there. We can't hear properly. Some voice disturbance and video disturbance also is there. That's why our suggestion.
Yeah, the Wash Network is hosting this, so I pass this message on.
Google Meet is the best. Google Meet is the best. I think so.
Okay, Esther, please, over to you.
Hi everyone, my name is Esther John. I work for Norwegian Church Aid NCA Nigeria. So I want to share experience regarding breaking the silence. So last year we have like a mandate from our head office to involve the religious leaders in celebrating Menstrual Hygiene Management Day. So before the celebration day, what we did is we trained the religious leaders from both aspects, both pastors, imam on menstrual hygiene management, and then we train community leaders. Though I work in emergency setting, in a camp setting, so all the camp around the area of intervention, we train the religious leaders and the community leaders. So on the Menstrual Hygiene Management Day celebration, we have school girls, we have the girls from the camp, we have women, we have religious leaders, we have community leaders, and then the community people. So it was like a big celebration at that moment where we have all people from different parts of the camp having their own contribution, celebrating the Menstrual Hygiene Management Day. So what we learned from the religious leaders and the community leaders is that sometimes the sanitation facilities in the camp is not menstrual hygiene management friendly, because mostly people find it offended or people find it disgusting if a woman is menstruating and then she use the bathroom or the shower during the day and then you have some blood outside, because sometimes the pit for collecting wastewater will be filled, and then so you see some blood outside. So women during menstruation at the emergency setting, they find it difficult to have their bath during the day because of that shame. And then if they take their bath in the afternoon and then they have that blood stain around the camp, so people will just be looking, oh, who is using this toilet? Who is using this toilet? So it was during that training that we find out that, okay, we need to do more in terms of in terms of latrine construction, shower construction, and then maybe we need to do more when it comes to trying to see how women can be able to access this shower bath at any time. So I think these are my points I want to share with colleagues. Thank you.
Thank you, Esther. And I have a question to you as a follow-up.
Okay.
We heard from Salam that they're using messages from the Quran or religious texts. Are you like, how do you convince religious leaders to go to support the issue?
Yeah, for the religious leaders, especially the Islamic leaders. So what we did is that we try to have their own perspective regarding what they understand or what the Quran says regarding women of menstrual age. Of course, when it comes to touching of Quran or praying during menstruation, we do not go to that. But we explain to them to see that, okay, even in Quran, they said cleanliness is next to godliness. So we use that hygiene aspect to see how we were able to convince the religious leaders. But of course, anything that the Quran is saying is against Islam during menstruation, we did not alter that. Yeah, thank you.
Thanks for adding that. I was because we had I feel a lot of us we face the same challenges, even like in developing context, at our home setting, in emergency context. So but I'm glad that we have a few extra challenges that we saw about, like in emergencies, like changing situations, then there's risks, so you can't get supplies of materials, there's sickness and disease. So I feel we talked a lot about general recommendations around education and awareness, but also really particular to the humanitarian setting. So I thank you all for participating today. I thank you all for your excellent contributions and questions. I want to give a big shout out to our wonderful speakers. Jane and Salam already had to leave because of other engagements, but I thought they were like really excellent and could have talked much longer. We're definitely going to share the recordings with you and the presentation and some key resources that we talked about in the context. And if there are any questions from you to the speaker, we make sure to forward them, and they're going to have this. And as promised, we do a quick survey so that you can cast a vote on the upcoming MHM and emergency webinars. There are going to be 2 next year and maybe 1 or 2 in 2025. So I hope to see you there as well. And with that, I wish you a good rest of the day. Thank you for staying with us today. It was really a lot of good insights. I'm glad that this was an excellent webinar without technical difficulties. We thank Cécile for the translation. And with that, I wish you a good rest of the year. And please keep on sharing your expertise, your tools, your questions, because that's we will all want to be connected and learn from you. Thank you so much, everyone, and have a good rest of the day.
Thank you. Bye bye, everyone. Ina, bye. Bye bye, Ina.
Yeah. Wait, I'll just make a photo for everyone who's still around.
Here we are.
Excellent. And thank you, Rob, for hosting. With that, I think we close it.
It was a pleasure.
Thank you.
Bye. Thanks, everyone.
Bye.
Au revoir.
Thank you so much and have a wonderful day, everyone. Bye-bye.
Bye-bye.
Bye.
Bye. Bye-bye.